I'm here today to share with you my journey and observations as a conventional physician with expanded knowledge and experience in alternative, holistic, and integrative medicine over the last decade or so. And I completed my original training in conventional medicine at the University of Washington. After completing my residency in internal medicine, I went to University of Washington to do an infectious disease fellowship. And that was the area that I chose as my subspecialty. And while there, I also obtained a master's in public health in the field of epidemiology, which means that I have additional experience and expertise looking at infections and how they relate to public health concern. And while I was in my training, I chose viruses specifically as my area of research and clinical practice. And I was working as an HIV and sexually transmitted disease expert for a number of years and stayed on at the University of Washington on faculty, was doing research and teaching as well. And what happened was, while I was in my training, I had to choose an area of study that was specific to and within the area of sexually transmitted diseases. And so I ended up choosing the area of study as human papillomavirus, and I'm going to speak with you about that in a moment. I was on a pretty conventional track as a physician in conventional medicine, starting out in that academic medicine pathway, doing research and teaching, as I said. And just to give you a picture of what that looked like, I was also a national speaker for Merck Pharmaceutical. And the reason for that was because of my area of research in HPV. And at that time, Merck was getting ready to launch their vaccine trials for Gardasil, which is for human papillomavirus. So I was also on an advisory panel for Merck, helping them to develop a testing tool for HPV DNA detection. I was married to a Pfizer pharmaceutical representative, and I had 3 children with him. And so I was pretty ingrained in this conventional world, if you will. I'm fully vaccinated myself, as are my children. I have family members who are physicians, and they are also support vaccination and have been fully vaccinated. And so this is a picture of human papillomavirus, a schematic, just to give you an idea of what we're talking about here and get everybody sort of on the same level. The viruses have genetic material in the middle of them, and then they have an envelope around them. And as you see in this picture, there are proteins on the outer envelope of the virus, the capsid protein. And this is what the virus uses to attach to cells and enter the cells. And in this case, for human papillomavirus, it's a DNA virus with DNA. That's the genetic material in the middle. Some other viruses have RNA material in the middle. And as I said, I was developing a testing strategy or tool for HPV DNA detection, specifically in males, because at that time, there was not a great way to test males for HPV, especially if they had no symptoms or signs of the virus. And this tool that I developed would later be used by Merck in their vaccine trials for males. And as I said, I was on this pretty conventional track. And about 6 to 7 years ago, a lot of things started to change for me. As would occur with a lot of people, I would say, in life, it's a series of difficulties or challenges that you face. And as a result of that, I started awakening even more, perhaps, than I already had been. And one of the things that happened was a friend of mine, Teresa, who I had trained with in residency, had died unexpectedly. And she was my go-to for so many things. She was a brilliant physician, to me, the smartest physician I'd ever known. And we used to banter about things, about the universe, about energy, about challenging medical problems that we would have with our patients and ourselves, even in our families, and how to deal with those. And after she died, I had to start searching for answers within myself. And this ultimately catapulted me into a massive awakening with a lot of changes in my life. And a lot of truths started coming in. And as a result of this journey, a lot of things changed. My relationships naturally changed. New people came in and others left. And I ended up opening a wellness practice. And in addition to that, I no longer support vaccination. And I was probably one of the biggest advocates for vaccination leading up to that. This is a picture to show you a jail setting. And the reason I show you this is because one of my other hats is that I'm a medical director at a large jail. And I'm operating there under my license, which is under the name Dr. Beth Mitchell. And this is my conventional hat, if you will, that I am still living within. And I love this job, to be honest with you, because it gives me the opportunity to help a large underserved population. And the people that I work with, the staff, are some of the most courageous people I've ever known, totally dedicated to what they do. And it's helped me grow and expand as a person and a physician over the last 15 years in doing this job as well. And the reason I'm bringing up the jail is to paint a picture for you. The jail is like a city. And as I said, it's one of the largest jails in the country. And at this jail, they book upwards of 50 to 55,000 people per year. On any given day, there are approximately 3,000 inmates living in the jail. And in this particular jail, it's called a direct supervision model, where it's open and people aren't typically isolated in their own area. They're living in an open area together with bunks close together, so sleeping near one another, a shared bathroom, share meals together. And the deputy is in the housing unit with the inmates for 12 hours a day. The nursing staff and other medical staff are in and out of the unit with them as well throughout the day. And so when this pandemic started coming through in the recent months, we had to develop a pandemic plan in short order. And we spent hours and hours developing this plan. Naturally, we had a lot of concerns about what might be coming because we were looking at the media and we were looking at what was happening in New Jersey and New York and California ahead of us. And we had visions of people ending up in the hospital and dying, and how are we going to manage this? Because when the inmates go to the hospital, it's a security issue and deputies have to go with them. And if there were no beds at the hospital, how are we going to contain this? And most importantly, how are we going to keep everyone safe within the jail setting, including the staff? Because as I said, it's for the most part, an open jail where it's impossible to isolate every single person. And in the jail, we have some of the sickest people in the community with both serious medical and mental health problems. We have persons who are aging. We have persons with comorbidities, high blood pressure, diabetes, heart disease, immune-compromised states like HIV and cancers. And so these are the folks who would be at risk, is what we were told, about getting really sick or potentially losing their lives from coronavirus. So we tried our best to isolate persons with those conditions who were already in the jail in their own area. And then people coming into the jail knew we would put into a different housing area. But there's only so much you can do with that because we have high-risk areas with infirmaries and detox units and mental health units, and those are needed for people with significant health risks and mental health risks. So we would still have to mix newly arriving inmates coming into the jail with people who were already residing there. And this would need to continue to go on over time. And so some of it was within our control, some not. There's no social distancing in the jail either, because the inmates are living in bunks close to one another, and we don't have 50,000 masks to give the inmates. We weren't even sure we'd have enough masks for our staff, and at one point there was concern we might not. We did correct that, but as that was the case for everyone in the medical industry across the country for periods of time. And despite all these efforts, in all the time so far that's passed, we've had 2 cases identified in our large jail. And both of these cases came into the jail with the virus already. One of them was known and one of them was unknown, but came from a treatment facility where we knew there were other cases. And he had a low-grade temperature of 99 point something at the door, and that was the only sign he had. And the other person had a dry cough and nothing else. And so nobody went to the hospital with coronavirus. Nobody suffered with serious pneumonia, and not much else happened. And that's a wonderful thing, actually, but certainly not what we expected and not the picture that had been painted. And while you could say that it's because of our efforts, which in part may be true, I don't think that fully explains the whole story. And so that's what I'm going to try to share with you today, is some of my thoughts about what's going on, as well as some other ideas. Because having worked in academic medicine and teaching in academic medicine, and then working in the correctional field, and also having a private practice that's holistic based, gives me a unique experience and view of different types of medicine being practiced today, and gives me a good idea of people and how they present and the kinds of things they go through with different ailments. So one thing that I wanted to mention was ozone. Ozone is something that I use a lot in my wellness practice and have become quite comfortable with. Ozone is made from oxygen. It's inexpensive because it's made from oxygen. Now, some of the modalities you use to deliver ozone to the body sometimes can be expensive, the equipment, but ozone in and of itself is not. And what I've found is that ozone is a very powerful anti-infective and also very helpful with inflammation in the body. In lower doses, it's a wonderful antioxidant, and in higher doses, it's a wonderful oxidant, so to say, which helps remove inflammation from the body and helps detoxify the body. But I can't talk about ozone at the jail, and I can't talk about it if I were still in academic medicine, because ozone is not part of the standard of care, part of the guidelines that doctors are operating under. And these practice guidelines are in large part put out by Centers for Disease Control, the World Health Organization, NIH, and others that ultimately have other conflicts of interest, I've learned. Now, when I was in my conventional path, I believed that these agencies and these guidelines were scientific, evidence-based practice guidelines. That's what I was taught in medical school and in my training, and I believed that. Because after all, I was raised to believe that you listen to your authorities, you listen to your parents, you listen to people older than you that know more, and you do as they say. And that's how I was raised. But all of that's changed. And I've realized now that the answers actually lie within ourselves. And if we're all God-based, which I was also taught in my Christian upbringing, that we are all part of God. We're all part of one body, and we all have the answers within us because of that. But how often are we taught to actually go within and find the answers for ourselves? And how often do we trust that? And so I find myself in this duality, working in both sides of wellness and holistic medicine as well as conventional medicine, because of something like ozone, which would be so terribly helpful in a pandemic from a presumed virus causing it. I know that if someone comes down with the flu and they take a systemic ozone treatment early on in the onset of the illness, they're either 100% better the next day or at least 80 to 90% better. And you're not going to hear about that in the mainstream. You're not going to hear that when the president is talking with the task force. Although he did mention something one day, didn't he? And guess what he was ridiculed for, wasn't he? And because the media and the task force don't want them to be talking about other alternative forms of treatment that may be helpful if there's not a benefit to the pharmaceutical industry. And that's not meant to be an inflammatory statement, it's just the truth. And at the end of the day, I am a truth seeker. I always have been. It's just part of who I am, and it's probably why I went into medicine and probably why I became an infectious disease specialist, who tend to be detective types in medicine who come in a lot of times late in the game in the intensive care unit to figure out what is going on with this fever or pneumonia or whatever. And so I'm here today to share with you some of unique observations that I've had, not just with viruses, but other things in medicine that may shed some light for us these days as we are embarking into uncharted waters. It feels many days these days. And so when we think about how do we heal the body and how do we choose treatments that are best, I think it makes the most sense that we choose things that are nourishing the body and feeding it what it needs so that it can thrive the way it was intended. And when we take treatments that have toxicities that we then have to deal with afterwards, sometimes that creates challenges we didn't anticipate. And so when we use medications, I think it's very important that we're mindful about those toxicities. And I'll never forget a situation that occurred with my father where he lost his mind acutely one day out of nowhere while working on the boat. He's in his 70s, he's an engineer, he's a type A personality, still works part-time at that time, and all of a sudden he didn't know who he was or where he was or what was happening moment to moment. But he seemed to be walking around and speaking okay, and so what's going on here? It doesn't seem like a typical stroke. Maybe he has heat exhaustion. We brought him inside, cooled him down, didn't work. So he went to the hospital and had a massive workup for all kinds of things, and everything was normal. No blockages in the carotid arteries, no heart attack going on. CAT scans and MRIs of the brain are normal. Electrolytes are normal, no kidney problems, liver looks good, you name it, he had it, everything looks beautiful. So the neurologist came and said, this is a classic case of transient global amnesia. Now, I'd seen a case or two of this in my career, and that's it. And the neurologist shared that this is becoming more common, especially in the elderly population. And the reason it turns out that this occurred with him is because he was on a cholesterol medication, simvastatin. So the statins are commonly used for cholesterol lowering, and they're very powerful cholesterol agents. So much so that they cross what's called the blood-brain barrier, and they lower cholesterol levels drastically sometimes in the brain. But the brain is supposed to be bathing in fat to some degree. And the fat is coating and bathing all around the neurons and allowing them to connect and allowing a nice electromagnetic circuit for synapses to fire and thoughts to connect. And so when you drop that fat level abruptly in the brain of an elderly person especially, you can create this acute problem. Now, did the neurologist tell me that at the hospital? No. The neurologist said, I'm sorry. We don't know why this happens, but it'll get better. But don't worry, nothing else. We didn't find anything else going on. And he was discharged home. Now, that wasn't an acceptable answer for me. And so at the time, Teresa was still alive, and Teresa was at my home right after that, and she inserted herself in the entire thing, which was her common practice. And she said, let me guess, he's on a statin. I know what happened. And she told me the whole story. And he had just started the cholesterol medication 3 months prior. His primary care physician had started the medicine because his cholesterol was a little elevated. Now, he has no history of coronary artery disease or heart attack, but because that it just happens in conventional medicine, it's common that a medication comes on the market. There's a lot of studies around the clinical indications and uses for that medication, and in this case with statins, it was around heart disease. So if you had a heart attack, and there's all this data around the use of it in the setting of known blockages in the vessels. But that wasn't his story. And so what happens over time, though, is, well, if your cholesterol is elevated, we know that it lowers it. Let's just put you on the drug without a lot of thinking about the long-term sequelae of these decisions. And so she advised me, Teresa did, of looking up a website, spacedoc.com. And this was a website developed by a NASA astronaut named Dwayne Graveline, who's a physician and master's of public health also. And he, too, had suffered from transient global amnesia from a statin. And so his doctors convinced him to restart it. He had a feeling his symptoms were related, and he restarted it reluctantly, and the amnesia returned. So he then dedicated the rest of his life with a book and website into educating people about this problem. And so we can accept that there are toxicities and adverse effects from medications, and that's fine. But how often when you go to your conventional doctor, do they share with you these potential problems? And do they identify them when you return, saying, I've noticed this is not helping, or this is doing this or that? And really the most important point is that the patient always knows the answer and knows what's going on, and it's important to listen to those things because sometimes these adverse things have come out later.
Our physical body is a massive ecosystem, hosting a whole community of microorganisms serving as communicators of information throughout the body. Everything we ingest, breathe, touch, and place on our skin ultimately affects our microbiome and our ecosystem.
And so, as I mentioned, as an infectious disease specialist, I had to choose an area of study, and viruses was always something I was most fascinated by. And so microbes in general, of course, always fascinated me as well, which is why I chose the field of infectious diseases. And you hear about the microbiome. I think almost everyone knows what that is these days, gut health, and what's the status of your gut health. And even in conventional medicine, this is widely talked about. And a lot of people probably are on a probiotic these days. And so that's becoming more normal to talk about the status of your gut health or your microbiome. And this picture shows you a schematic of the large intestine with the small intestine behind it, and the large intestine there in pink with all the microbes in it. And really, when you're hearing about the microbiome, it's mostly referring to bacteria or the bacterial flora. And this would apply to all the mucous membranes in your body, your nose, your mouth, your anus, vagina, any of these areas, as well as the bowel and the stomach. And all of these areas have a unique bacterial flora that's unique to that environment, depending on the pH and other things that are intended for that organ system to do. And you may hear about yeast and things like that in the microbiome, but it's very uncommon for you to hear about your virome, What's the status of your virome? That's your viral flora that makes us up. And how often do you hear about that when you go to your practitioner? I'd say probably never. And this is what fascinates me the most. Now, a lot of microbes have been associated with chronic conditions and cancers. And so as an example, Epstein-Barr virus, a lot of you may know what that is, EBV, that's been associated with lymphoma. Other things like cytomegalovirus, that's a virus most of us get as kids. And there are a lot of different types of strains of that virus. That's been associated with, it was a research project that I was involved in my residency, and we looked at how that might be associated with blockages in the coronary arteries after they're opened up by the cardiologist with a stent. Sometimes people get restenosis or a blockage occurring right afterwards in short time. And we could tie that to this virus as well as a bacterial respiratory pathogen. Hepatitis B and C virus associated with liver cancer. Human papillomavirus, which I mentioned I studied, associated with cervical cancer, penile cancer, and oral cancers. Helicobacter pylori, that's a bacteria that you may have heard about that's in the stomach. And that's, when identified, been shown to be associated with ulcers in the stomach and gastric cancer later in life if not treated. And so what is my point in telling you all this? Well, just because a microbe is identified in the tissue where a disease state has manifested, or in the blood or what have you during that condition manifesting, does not necessarily mean it caused it. We presume that it does, but they're working out which came first has not really been well sorted out. And so that's why I use the word association. And so viruses get a bad rap. Usually viruses are referred to as misery. And I mean, I'm not saying not with good cause, but what I hope to do today is to give you an idea that perhaps they're not the only thing going on that's causing the misery. The immune system can tell us a lot about the microbes and what's going on in the body. And as an example, we can look at the organ transplant population. And I have a special interest in that, for one, because it involves infectious disease specialists. And so I have some experience in that when I was in my training, but also I have a close family friend who received a heart transplant, and my father-in-law also received a heart transplant and lived with us during that whole process. So I can speak about that fairly comfortably. And so when someone receives an organ transplant, it's terribly important to understand their immune status, even going into the organ transplant. And that has to be worked out. And so as an example, if you had, let's say, herpes virus as a child, most of us have had or been exposed to herpes type 1 in our young adulthood or childhood. That would be known by an antibody test before you go into the transplant. And so let's just say it's known that you're herpes 1 positive, you're cytomegalovirus positive, just to keep it simple. And then you get the organ, and after the organ and during the process, your immune system is suppressed purposefully to prevent you from rejecting that organ because you're receiving a foreign body, in essence, in your body. So when the immune system is suppressed, you're at risk, though, and we know from clinical experience, for some of those viruses you were exposed to many years ago to reactivate. So now you present with a fever. Well, now we have to go fishing and figure out where's the fever coming from. Is it the virus, one of those viruses I mentioned, reactivating? Or is this the organ that you just received? Are you rejecting it? And there are other things to consider, but just to keep it simple. And so let's say, we do a battery of tests now, draw the blood or do a biopsy of the organ, all these things possibly. And we find that, oh, it looks like the herpes virus is, causing the trouble. We're testing it with PCR. PCR is a way of amplifying the virus using the genetic material of the virus in the laboratory. And so if we can amplify it, we can measure it with number of viral copies. And so if there seems to be a high level of that virus hanging out in the area, it's presumed that it might be part of the problem. And so we back off the immune medications and we allow your immune system to come up, and then it seems to improve. And so now that organ transplant medicine is a common practice these days, we've learned a lot about viruses in that experience and what's happening in the body. Another way we can look at viruses in a natural history kind of a way with the immune system is by looking at pregnancy. So in pregnancy, for obvious reasons, a lot of times we wouldn't be as aggressive with certain things as we might be if you weren't pregnant, so as to protect the baby or prevent miscarriage. And so women who develop abnormal pap smears during their pregnancy, maybe even cancer on the pap smear, maybe a high-grade dysplasia on the pap smear, are then tested for HPV, human papillomavirus, and they may be positive. But you're not going to go in and burn or cut off part of the cervix, which is what the treatment is, to treat that in the conventional medicine during the pregnancy, because you would put her at risk for miscarrying. And so we watch her through the pregnancy. And what we find is that in most instances, after the woman delivers the baby, the pap smear gets better. Sometimes resolves completely, and nothing needs to be done. Now, you wouldn't ordinarily practice that kind of natural history protocol if they weren't pregnant in conventional medicine, for fear that you weren't practicing standard of care and for fear that somebody might progress to cancer if you didn't. But what that tells us is that the immune system and the virus are playing this kind of role with one another. And again, just because HPV is there at the time that the inflammation on the cervix presents does not mean that it's causing it. Now, you might say, well, it seems clear, but you haven't proven that yet. And so let's talk for a minute about the virome. And this picture gives you a schematic of some viruses, some of the more common ones: coronavirus, influenza, which causes flu during flu season. And you see some of the others there: papillomavirus, which I've already mentioned, herpes virus. And some of the things you might notice about the picture here, which was intended, is they're actually quite beautiful. And they adhere to perfect geometry, every single one of them, which is interesting to me. And what we know about viruses is that, from the virologists, is that they say viruses were the first things to inhabit Earth, that they've been around longer than any of us. And as an original seeder of this Earth, that fascinates me. And it helps me understand why I might be fascinated by viruses. And during this pandemic, when many of you might have been at home watching movies or doing social media, my idea of an enjoyable afternoon is to sit on my patio and listen to virology lectures while I sip my tea. And that's why I'm an infectious disease specialist. So when I go back to the books and I start reviewing virology all over again, I'm looking at it with a new lens. And I'm asking questions that I didn't ask when I was in medical school or think about, because at that time I was sort of blindly accepting what I was learning and not as perhaps inquisitive as I am now. These days, I tend to question everything, every single day. And that's just getting more all the time. And I'm discarding things that no longer make sense or serve us, and I'm adopting things that do. And the more we grow and expand, the more we should be doing this with everything. But especially I'm doing that in medicine. And these viruses that have been around forever are ubiquitous, so they're everywhere. They're in the oceans, they're in the plants, they're in the animals, they're in the humans. And interestingly, plant viruses cause no human disease at all. Animal viruses, well, some of them have been associated with some of these disease states that we've been talking about, and others. And how does the virus get from the animal to the human, back to the animal, and does it always occur, and in which order? All these things are not clearly known about how all this happens and how viruses are shared. With the contagion germ theory, which was developed and propagated by Louis Pasteur. Louis Pasteur is basically responsible for pasteurization of milk. And so he propagated this theory of contagion or germ theory, which is that the germs are coming from the outside. But for 2,000 years before that, doctors and scientists believed that infections came spontaneously from within. And that was the theory of spontaneous generation. Another thing I wanted to note about these viruses is that there are RNA viruses and DNA viruses, and viruses are classified in other ways as well. The RNA viruses, this is the type of genetic material in the center of their structure, mutate regularly. This is normal for these viruses. So as an example, flu mutates regularly. Human immunodeficiency virus, HIV, mutates regularly. That's why it's difficult to develop a vaccine against these viruses, because as fast as you develop the vaccine and you do your safety trials, then by the next season there's a different mutated virus, because RNA viruses are mutating because they're evolving. And they're here to help us evolve and assist Mother Earth in her evolution as well. And so this is a beneficial aspect of these viruses rather than a negative. With the advent of electron microscopy in the 1930s, this allowed us to see viruses and really help this field expand, because viruses are small. And so the electron microscopy allowed it to look larger and start seeing viruses differently than other microbes. And this helped the field of infectious diseases really expand. Atomic imaging is a newer imaging that came out in the 1980s, and this allowed us to see viruses even in more detailed way. And this is a schematic of that, showing again the perfect geometry, the beauty of this is a polio virus. And the atomic imaging allows for some of the detail of the structure to be seen more clearly. And so these viruses are of so interest to me, because as we evolve as beings during this time, we're trying to understand how they may be here to help us. And microbes in general, I've noticed there's a theme here. And you may know about some of this already, just from family members or your own health. If you have a foreign body in the body, like a titanium in your hip, or pacemaker in the heart, or some other kind of metal foreign body, you may know that you're at risk for that becoming infected. So when we brush our teeth, we have bacteria naturally go in our bloodstream temporarily just from the act of brushing your gums. And that bacteria may go on jump onto, that's how we say it, they may jump on the foreign body, let's say the pacemaker, and set up an infection there. Now, that doesn't commonly occur, but it sometimes occurs. And so this is a well-known thing in conventional medicine. And if hardware or foreign body becomes infected in the body, then it might have to be removed and replaced because antibiotics alone or other treatments against that bacteria may not be adequate. In my practice, I also, in my wellness practice, see that most people are heavy metal toxic these days. And there's a whole variety of reasons why. First, we inherit heavy metals from our mother and their mother and their mother. It's being passed through the mitochondria. And so some of the toxicities from things from several generations ago are still being passed through. But our environment also is tainted with a lot of heavy metals in the soil and chemtrails and other ways we're getting exposed. Vaccination. Even in vaccination, we are exposed to aluminum. It's the adjuvant in many of the vaccines, and it's being used to stimulate the immune system. But no one's talking about what's happening to remove the aluminum afterwards. Aluminum has now been shown a strong association with things like Alzheimer's, ADHD, sometimes autism, schizophrenia. And so I also see that people who are heavy metal toxic have viruses often and other microbes, for lack of a better word, hanging out in the area where the heavy metals are hanging out. And it's believed that the microbes are feeding on the metals, and that may be true. And there's probably a lot of reasons why they're associated with one another, but I would submit that the viruses are also there for another reason. Now, interestingly, while I was preparing this talk and coming forward with some of these ideas, my daughter, that's how the universe works, is synchronicity, and you start getting confirmation of things right in front of you in your own personal daily life. And so I was sitting on my patio working some of this out, and my daughter started texting me from her bedroom upstairs, which is normal for a teenager, and telling me that she had a problem with her ear and I needed to help her immediately. And she's a healthy child, so she never had ear infections, so this was kind of unusual. And I've been learning how to work with my hands energetically, working on people, coming into my own gifts over the last year. And when I'm working on the body, I can sense what's going on with heat or cold, different temperature changes, and different sensations, using my hands as well as connection to my body and the earth to figure out what might be going on. So I just tapped into her field with my hands while I was sitting on the patio and she was texting me, and I wanted to see what's going on with her ear. I didn't know which ear it was, she didn't tell me, but I decided I would figure it out for myself. So I could feel a lot of heat coming from her left ear. And I worked on it for a few minutes, trying to see if I could resolve some of the heat. And then she walked down on the patio, and irritated because I wasn't answering fast enough, and she wanted to know, what are we going to do about this? So she asked if I could look in her ear with an otoscope, because she knows I'm a doctor as her mother, and as far as she knows, that's what you do. You look in my ear and see what's going on and get this taken care of. So I didn't have my otoscope there, so we had to go to my office. And I said, well, I'll go look in your ear if you'll do some other things for me when we go there. So she agreed. And while we were there, I did some other scans on her, these energy scans I have, and wanted to see what else I could see what's going on. When I looked in her ear, she did have pus in the canal and a lot of inflammation. And what I haven't told you yet is that I knew it was her left ear, and it was her left ear. And I knew that from my energy work. I honestly forgot that she had recently got an earring in her little cartilage here in her ear. And so it was on the same side. And that's what was infected. And there was pus coming out of it, and redness and heat. So on my energy scan, though, what came up with a really strong match was a match for a virus. I thought, that's peculiar. She doesn't have any respiratory symptoms, no cough, no fever, no systemic anything. And it was isolated to the ear. But that was right in line with what I had just been working out, that even in a setting of a bacterial infection, let's say, with a foreign body that's metal, ordinarily the treatment of choice, if I took her to the pediatrician, would have been antibiotics, which would have then decreased her microbiome and her bacterial flora in her gut and her vagina and all over her body, and then she might have got a yeast infection after, and then we had to deal with that. And so, I don't like to go that route if I don't have to. So I used a little ozone on the area topically, and I gave her supplements to help boost her immune system. And I told her, you got to take the earring out, because the treatment of choice is remove the foreign body. And after all, her body was trying to reject the foreign body. Her body was trying to let her know, this is not highest and best for you at this time, and you might want to remove it. And her, being a teenager, said, what? I don't want to do that. So humans being humans, we want what we want. So I said, that's fine, keep it in then, keep suffering. So we kept applying topicals, and it improved for a bit, but then it returned. So 2 days later, she said, fine, let's get it out. So we took it out, and everything healed beautifully, and she's fine. And she's threatening to put it back in. I said, well, whatever you think, but you might get back the same problem. And so my point in telling you that was hopefully to illustrate the point that, do I believe that the virus was really causing the problem? I don't. I think the foreign body, the earring, was causing the problem, and there was bacteria, I'm sure, involved, and white cells were in the area. That's the pus that she was generating to deal with it locally. I think the virus was there in an effort to deal with the inflammation and assist her in resolving it, and I'm going to show you why a little bit. But first, I want to talk about testing, because it's important to get an understanding of that from a lay point of view. So most patients are really focused on their test results, which I understand completely. We all want a magic bullet, and we want a magic pill or a magic treatment, and we want a magic test. But it's not that easy most of the time. And we learned from HIV testing now for a couple of decades that there are difficulties with tests, especially screening tests for large populations of people. So when you have a screening test, because you want to know how many of the people have the disease, you want the test to get it right most of the time. So imagine if you implemented an HIV test with such huge implications as HIV, and your test was wrong a third of the time. It's totally unacceptable, right? Even on either side. Because if you get a false negative, you don't want that, and then you don't want a false positive either, especially if there's implications with insurance and other things, stigma. So there's an antibody test, and that's one way of talking about viruses, which is looking to see if you've developed an immune response. And then if you have developed the immune response, the antibody, is it sustainable? Is it high enough of a level to prevent disease? Those are all things that have to be well worked out, and it takes time to sort that out. And with testing, you need a gold standard. That's typically what we're taught in conventional medicine. So you need some kind of gold standard in the laboratory to compare things to. So a lot of times when new tests come on the market, be a little leery. So with coronavirus, what we're finding in some of the studies and data that's come out so far is that some of the testing may be wrong up to a third of the time on both sides, with false positive and negatives. And when I say that, I'm referring more so to the PCR tests. The PCR test, or real-time PCR, RT-PCR, is a test which, again, is looking for actual virus, different from the antibodies. So if you're looking for actual virus in the tissue or in the blood, you take the sample, send it to the lab, and then they're trying to amplify the genetic material of the virus and see if all the proteins match up, and is there And anyway, they're looking to see if they can amplify it, and then they're looking for a level. So are there 1,000 copies of virus, 100,000 copies, 1,000,000 copies? And you have to sort out what the threshold is. So in HIV, if you have an indeterminate antibody test, meaning we're not sure if it's positive or negative, it's indeterminate. You then might have a blood test done to see if there's actual HIV virus in your blood by PCR. Well, some people have 900 copies of HIV in their blood according to the test. But because it's below 1,000, it's considered negative. That takes a lot of counseling to tell a person that, because they don't understand that. But because there's false positives, and the labs aren't perfect, and this testing's not perfect. And so it's important to keep that in mind when we're talking about these different types of tests and what they mean. And with that in mind, if we look at case fatality rates for coronavirus or COVID-19, that's computed by looking at the number of deaths that's presumed to be caused by the virus divided by the number of infections. And so right now, a lot of the deaths, the number of deaths, we feel is overinflated, I think a lot of us, because we're hearing about how doctors are being forced to put coronavirus on the death certificate, even if it wasn't likely the clinical cause of death. So someone comes to the hospital, they have a heart attack, seems like a heart attack, everything looks like a heart attack, they die of a heart attack. But they also had a positive PCR test at the time for coronavirus, because they're all getting screened in the hospital for coronavirus on entry. Generally, coronavirus is going to go on the death certificate. Now, from a billing standpoint, you are able to collect more money if you have that billing code on there, and that's just a reality. So it ends up on the death certificate a lot of times. And so if we assume the number of deaths that we have at this point is correct, which I think I've explained it's probably falsely a little high, and we assume we have the number of infections, and we know that that's being reported, then we can compute a case fatality rate. Now, I would submit to you that the number of infections is probably much higher than what we know. And how do I know that? Because we already know that there's a false negative rate. So that means that false negative means you have the condition. There is coronavirus there, but our test didn't find it. So if that's occurring even 10% of the time, but it's probably higher, then the number of infections is actually higher. And there are studies coming out now showing that in New York, they did a random sample of about 3 million persons who had no signs of coronavirus, had not tested positive for it, and they had about 20% already showed antibodies. And so you would count that as people who've been infected, but that's not being counted in these case fatality rates. So if we take the numbers we have, though, with what's being reported, it's still low, the case fatality rate. It's about 0.05 to 0.1%. That's about what flu is every year, every season. And we don't close the whole world down for that. Now, admittedly, a pandemic means that it's affecting the whole world at the same time, and that's fine, that's true. A mystery pulmonary illness is affecting the whole world, and there are deaths occurring, and that does seem to be true, even if it's being inflated or overcounted. And so if we look at the history of pandemics, this is a schematic of it, and in the upper left corner, this is the highest number of deaths ever from a pandemic, and in the lower right corner on the bottom is the lowest number of deaths from a pandemic. So the number of deaths from a pandemic is coronavirus in the lower right corner. Okay? And to the left of it is SARS, and to the left of that, MERS. Those are other pandemics that were experienced to a lesser degree from a mutated other form of coronavirus. At the top, you see in the turquoise, 3 over from the top left, you see that's Spanish flu. So the Spanish flu killed about 50 million people worldwide. And the Spanish flu occurred in roughly 1918. And there are a lot of similarities between the Spanish flu and coronavirus, and a lot of differences. Some of the similarities are that with Spanish flu, people were showing up with this pulmonary syndrome very similar to the severe cases we're seeing now. Some of them turning blue. Why? Because their oxygen was really low. And having other symptoms similar to respiratory illness. The case of Spanish flu, people were dying abruptly. This morning they seem fine, and tonight they're gone. And whole towns were dying. So when you go back and look historically at what happened then, you see pictures that remind us of what's happening now, and the pictures are similar in that everyone's wearing a mask and things like that. Even animals and horses had masks on and things like that. And at that time, they really didn't know too much about microbes and viruses the way we do today. And you can imagine how much fear they might have all been experiencing. The differences, of course, is that we're reacting now to coronavirus the way we did then without a whole lot going on in terms of deaths. And so it doesn't all add up. And so during all of this, I've been asking myself a lot of questions, like, well, we can't practice social distancing in the jail. We can't all wear masks in the jail. Even though the medical staff are wearing masks, the deputies aren't, the inmates aren't. The deputies are going home every day and going to the grocery store and going home to their families and coming back to the jail. So they are, in theory, coming in contact potentially with coronavirus, as are the medical staff. And if a lot of people are walking around without symptoms but spreading it, why aren't we spreading it in the jail? And what we're learning from the authorities, right, is that the nursing homes and the facilities like that are at highest risk and that they're having a lot of trouble in those areas, which I think is true. Maybe not to the degree that we are hearing, but it is true. And so why aren't we seeing it in the jail then? Now, it's not as though all jails and prisons are having the same numbers we are, but they're not having catastrophes. They're having sporadic cases. And why is it that we can't go outside and breathe fresh air? That doesn't make any sense to me at all from an infectious disease point of view, at all. If you have tuberculosis, and we still have lots of tuberculosis in Florida where I live, it's still exists. And we see it in the jail too from time to time. And the classic person who gets tuberculosis in the classic way, with night sweats and cough and so on, prolonged illness over time, is alcoholic living on the street. And even after the alcoholic with living on the street gets tuberculosis, they get placed on antibiotics, and after a week or so, couple of weeks, they go back to the street. And as long as they're taking their medications, it's allowed. The health department actually has staff who go out and dose them under the bridge and ensure that they're taking the medication, but they're allowed to breathe the same air as we are and walk around. They don't have to once they're cleared, they don't have to wear a mask. And actually with most viruses, respiratory isolation is not needed. Now, some viruses it is, but it's not common. And so in the beginning, we were being told that we needed negative pressure isolation cells. That's what we use for tuberculosis when it's actively, being treated in the beginning. So not all facilities have enough negative pressure rooms. And so if that were true, and we were being told you need N95 mask. An N95 mask is a particular kind of mask that prevents viruses from passing through, small viruses and other microbes. Well, cloth masks have pores in them, anywhere from 50 to 500 micrometers. And viruses are coronavirus about 0.015 micrometers. And so if somebody coughs through that, it's going to go right through. And so that doesn't make a lot of sense. And why can we go to the grocery store and touch everything? I know they're wiping everything down, but it would be impossible to wipe down everything that everyone's touched every minute. And we can go to the grocery store and do that. We can go to the liquor store and get that. But we can't go to the parks. Why are all the parks closed? And maybe it's because they're wanting to exert more control, and because the parks are government, and they don't want the liability, and maybe because they can't be sure we're not practicing social distancing. I'm not really sure why. Maybe initially all that was because they didn't know the case fatality rate. That's understandable. But within a short order, we started knowing the case fatality rate. And we certainly have a good idea of what it is now. And so why do we have to bother with all these phases if we know the case fatality rate? Is this what we're going to do every flu season also, just for flu? Because we still have 300 to 700,000 deaths from the flu every year. You don't hear much about that normally.
I want to also point out that before this pandemic, we didn't have testing available to the public for the coronavirus causing this syndrome, COVID-19. We never went looking for it in respiratory secretions until this recent respiratory syndrome was described. Before that, as mentioned, we had SARS and MERS, also with respiratory syndromes that were associated with other coronavirus strains. So if for a moment we entertain the notion that it's possible that the virus is not what's causing the pandemic, but may only be serving as a biomarker for the illness, with some patients developing a severe respiratory mystery pulmonary illness that looks a lot like an altitude sickness causing hypoxemia or low oxygen in the lungs and the blood. And if we start asking what could be causing this significant insult or injury at the same time across the globe to everyone all at once, and as many of you likely know, there's a growing body of evidence suggesting that it's 5G caused by this new cellular technology or updated cellular technology available to us now. If you look at a map where wireless 5G cellular technology has been implemented, it matches areas where there's been greater clinical problem with COVID-19. Scientists have postulated that the implementation of radio communication across the globe in 1918 caused a similar disruption in the body, as is occurring now with the implementation of 5G. And in 1957, the Asian flu pandemic occurred after radar technology was introduced across the globe. We know that 5G is used by the military successfully for crowd control, and that acoustic neuromas, which is a form of a tumor in the brain, are associated with cell phone use next to the head. It's been observed that TSA personnel are now showing an unexpected rise in health issues and disability claims related to DNA damage in the cells secondary to chronic radiation exposure with these airport scanners. These scanners were widely implemented after 9/11 in 2001. Using dark field microscopy, it's been shown that the cells begin to go in what is called anaerobic metabolism, which is metabolism without sufficient oxygen, which is in effect a form of fight or flight, and basically a low oxygen state ensues. And this occurs when the body is exposed to 5G. 5G uses a much higher frequency of millimeter wave technology compared with other cellular technology. And this is equivalent or greater than microwave radiation. And microwave radiation, we know, is already listed as a class 2A carcinogen by the WHO. And to roll out this new 5G technology, many more cell towers are necessary, including satellites in space to link these towers, all with close proximity to our homes and our workplaces.
This is a picture taken right from the CDC website from June 2nd, 2020 of the accurate what they're reporting as the COVID cases in the US and deaths as well. Now on the bottom of the slide, I added, that's from myself, not the CDC, notice the areas with highest cases in the darkest bluest color are coastal. And these are areas where there's higher air pollution. Now, not entirely, but there is a theme there. And so there's papers starting to come out looking at that you can directly correlate, almost like a dose response, as air pollution goes up, the severity of pulmonary illness goes up, and the number of cases goes up. So that's interesting from an epidemiology point of view. Another thing is, if you look at 5G maps, and you can find these by going to the cellular websites, Verizon, Sprint, Mobile, whatever. And when you go to their websites, they'll post a map of where, or list all the cities in the US where 5G has been fully implemented. Now, 5G was implemented first in Wuhan. So maybe it's a coincidence. If you look at the major cities, even in Florida, 5G was not widely implemented in Florida except for Miami, Panama City, I think. And Miami was where we experienced the most cases in Florida, similar, to New York and New Jersey or something that looked close to that. And that was blamed on people running from New York and New Jersey down to South Florida, which even after that was stopped, though, and borders were closed, it still was happening. And so I think this is of significant interest and should be at least explored. The World Health Organization, what did they say about electromagnetic fields? Well, they have listed electromagnetic fields relating to cell phones or mobile phones as, they first listed as a class 2B or a group 2B carcinogen. This is IARC, the International Agency for Research on Cancer. And they report for us associations with environmental things, among other things, and microbes too, and their risk with cancers. And so they could not ignore some studies that came out in 2011 to 2014 suggesting that people using cell phones and keeping them close to their heads for long periods of time seem to have an increased risk for the development of acoustic neuromas and other brain tumors. Arthur Furstenberg, the author of the book The Invisible Rainbow, has spent really most of his career now or life trying to educate people about what he refers to as atmospheric electricity. And in his book, The Invisible Rainbow, he does a wonderful job correlating the pandemics, particularly the big ones like Spanish flu and Asian flu. So the Spanish flu in 1918, Spanish flu in the 1950s, with global implementation of electromagnetic technology in the world. So when radio communication was being introduced in the world in the early 1900s, it coincided with the pandemic of the Spanish flu. And in the 1950s, radar technology was being widely implemented. And the military have experience with radar technology and know that it's a helpful tool for crowd control. If you introduce radar to help mitigate your crowds and disperse them, it works because it's irritating to the body. And so Arthur Furstenberg does a good job of describing all of this. Because after all, we are electromagnetic beings. We know this, even in conventional medicine. You can do EEGs to measure your electrical activity in your brain, EKGs to measure electrical activity of the heart. We are 70% water. Our cells are 99% water. And so imagine the water vibrating when it's in close proximity to another frequency that's vibrating, perhaps in a way that's disruptive. And that's what this atmospheric electricity is described as. Now, Dr. Mercola, who I think most people, at least in integrative medicine, are familiar with, has written a wonderful book as well called EMF'd, and he put that out in February of 2020. And he talks about 5G, but it took him a couple of years, he says, to put together the data to explain a lot of this and what might be happening in the body. What's of significant concern to me and Dr. Mercola and others is that when you go to the website, the World Health Organization website, and you go to this IARC place and you're looking for more information, you can't find much. And the reason is there are no human safety trials for 5G. And the FCC has allowed for this. And the FCC is a governmental body that's here to, it's supposed to be here to protect us from a safety point of view. That's supposed to be the first priority. And so before something like 5G gets widely disseminated, there should be safety trials. But there just aren't any. And the World Health Organization promised us, and that's shown here, it's hard to read, but that by 2016, there'll be an expert panel that will be presenting more information. That's all it says. So that's pretty outdated. So we don't know. And you can't just say something's safe because we don't, well, we just don't, they say, well, we don't know of any harm. Well, you haven't looked, actually.
Another thing that's not clearly known is whether or not respiratory viruses are fully eradicated from the body after we experience an illness caused by, or thought to be caused by, one or more viruses. In fact, even with flu, is that a new infection every time, every season? Or is it a reactivation of an old virus or remnants or parts of virus that reassemble each flu season when the body is trying to heal from some exposure, possibly air pollution, 5G, the combination, and more? Other questions are of concern for me personally. Is there an electromagnetic grid that remains in the lung tissue and the respiratory tract after a virus is eradicated from the area? What are the consequences of having this grid intact? Is the body continuing to launch a response to the area to contain or correct this grid even long after the virus has long gone? With the Spanish flu in the early 1900s, there was also conflicting data as to whether or not viruses or germs were directly transmitted person to person. And even if viruses were being shared between us, between people. During the Spanish flu, there were some studies performed suggesting that the virus or the illness was not contagious from one person to the other. Studies where healthy subjects were exposed to unhealthy subjects who appeared to be ill with the Spanish flu. In some of these cases, the secretions from the persons who were ill were taken from the people who were ill and inoculated into the healthy subjects, and still the healthy subjects did not become ill. They also tried other experiments in which the sick people would cough and sneeze all over the healthy subjects, and the healthy subjects did not become ill. And they didn't have in those days the ability to check for immune system response or antibodies. And so one could argue that perhaps the healthy subjects didn't become ill because they were all immune. But how is it that 100 random healthy subjects were all immune? Normally in a study, you would expect that at least a small portion of the healthy subjects would not have been immune and therefore should have become ill. especially if the virus was considered to have a high attack rate? And how is it that so many people became ill so quickly at the same time, within hours, and died within hours? It would seem more likely to me that it was some sort of a large environmental exposure that the entire population was exposed to at the same time, and that multiple people succumbed to that at a high rate, and only a minority survived. Perhaps the minority who had the strongest immune system, the highest energy and voltage, and the healthiest mitochondria at the cellular level. I learned in my early research training in my infectious disease fellowship that the more you look for viruses in the body, the more you find them, even when there's no obvious sign of disease being caused by the virus. And this is something that infectious disease doctors in the HIV, STD arena would say commonly to one another. The more you look for viruses, the more you find them in the body. And in my study of HPV DNA detection in males, that's exactly what we found, that the more we sampled different areas of the genital tract of males, the more we found HPV DNA. Oftentimes in males with very little history of frequent sexual partners, and also without any evidence of disease associated with that area. If a robust virome in the body proves beneficial for humans due to some kind of natural, organic, evolutionary process, and if most viruses are actually here to assist humanity with evolution, this would ultimately make the need for vaccination pointless, because the goal of vaccination is to prevent the acquisition in the first place. And this limits the development of herd immunity, in which people are purposefully or accidentally exposed to a virus and develop immunity. But in the case of chickenpox, as mentioned, this is what people would do, is have chickenpox parties to get together and everyone get the illness, get over it, and develop the immunity to prevent future infection. And vaccination with man-made viruses or protein remnants of viruses actually disrupts this natural herd immune response, and could therefore be disrupting a natural organic evolutionary process. And we know also creates toxin overload in the body, which is not dealt with in any way by physicians or other healthcare systems. And in this way, distorted energetic or electromagnetic grids and messages for the immune system are likely being set up by this vaccination process. And it makes me wonder as well whether previous vaccination with influenza virus is a risk factor for potentially having worse problems from COVID-19, which would explain why many of the nursing homes have suffered and had such a large problem.
And so what's happening with the body is that we have electromagnetic grids in our body, and we have energy channels, which are well described as meridians through traditional Chinese medicine for thousands of years. And these grids and these channels are disrupted by all kinds of things in our environment. And so how is that affecting the microbes as well? Well, I mentioned the germ contagion theory that Louis Pasteur propagated, which seems like a decent theory, and we all adopted it, and that's what we live by, that microbes are coming from the outside, and when they come into the body, they cause disease or problem. Now, that's true in some ways. As an example, we have Staphylococcus aureus, Staph aureus, MRSA. Okay, MRSA is methicillin-resistant Staph aureus, MRSA. You all might have heard about that in the news, MRSA. 40% of us are walking around with MRSA on our body. It's in our nares, it's on our skin. We're colonized with it. This is normal conventional medicine talk I'm saying right now. This isn't anything woo-woo. So it's not a problem until it's a problem. And so it's a problem when it gets into the wrong place in the body. And so if the skin, which is a great barrier to these things, is broken down, it might get in the bloodstream. And then you might become acutely ill. And so Louis Pasteur was working a lot on bacteria, which are very different than viruses. And so when milk, the process of pasteurizing milk became available, this was in large part to prevent bacterial contamination in the milk that would make you acutely ill. Now, looking at viruses, while it's true that some viruses do seem to cause a problem and dis-ease in the body, it's true. So think about something simple like rabies. If a rabid animal with active rabies bites your arm, the skin is broken, maybe a blood vessel comes in contact their mouth with a blood vessel, and their saliva contaminated with a high dose of that rabies virus comes into your bloodstream, you could develop rabies, which is thought to be 100% fatal. So there are situations or examples like that, but that's unusual and rare and not the way in which viruses are typically behaving in the body. Our bodies are comprised of thousands of viruses, many strains of which we don't even know. Every year, more and more viruses are being identified. Just cytomegalovirus alone has over 20 strains. Human papillomavirus, the number keeps growing. I think now there's over 40 or 50 strains. And so they're ubiquitous, they're everywhere. And most viruses that we either acquire or create within the body, I think stay there for life. Most of the time we don't eradicate them unless we succumb to them or with them along with other things. And so really it's the state of the host, the state of the body, the immune system, and other factors which dictates what happens with that microbe. And so the cytokine storm, so to speak, this is your immune system. And a lot of people are talking right now about coronavirus, and the people who are having significant problem in the hospital, trouble breathing, ending up on a ventilator, etc., they're describing what's called a cytokine storm. And we talk about this in other situations in medicine where there's an overwhelming infection, it appears in the body, and the body is not handling it well, and there's this cytokine storm. So this is your own body's innate defense mechanisms being activated. And sometimes you get a high fever as a result of it. And this is what's meant by the cytokine storm. So another thought or another theory is called the Host-cellular theory. And this theory competed with the germ theory years ago. And this was another colleague of Pasteur's named Antoine Béchamp. And what he was trying to show is that it's not so much this idea of the germ coming in from the outside and causing the disease, it's actually the host. And while the microbe might be in the body contributing in some way, it's the host that dictates how the rest goes and the status of it. And so what if you were bombarded with air pollution and contaminated soil with Roundup and glyphosate and over-vaccinated with excess heavy metals in the body, and your diet's poor, and you're not drinking enough water, and you're depleted, and your microbiome is not very robust because you're on antibiotics all the time, or you're drinking the tap water which was filled with antibiotics. And your virome is also not very robust because you're at home in fear, living in a sterile environment, bathing in sterilizer, not going outside and breathing your own contaminated breath with your gingivitis. And you're not getting enough oxygen. So that is a recipe for disaster, truthfully. And what we know just from looking at C-section babies, they're at increased risk the moment they're born for all kinds of stuff because they're born in a sterile environment. They don't go through the vaginal birth canal. You know, when the baby's going through the canal, it's swallowing all the good stuff that mom has. And there's lots of microbes in there. So when the baby is born by C-section and goes straight to the sterile table afterwards, they are actually at increased risk for having a weak or not robust microbiome in their gut. And you'll see they end up having things like eczema and other problems, asthma, until that flora changes. And so that's some of what's going on now with our social distancing practices and so on. So are viruses ever really eradicated from the body? This is bantered about by virologists, scientists, doctors, and they can't come up with an answer that everyone agrees on, of course. And I'm showing you this slide of the cervix because this was my area of study. And my researcher, my advisor, who I worked with in my fellowship, did a fairly provocative study while I was there. She was already doing a natural history study of women with human papillomavirus and abnormal pap smears in college girls. And she followed them even after they graduated college. They came back every year, sort of like a reunion, even after they graduated for their annual checkups. And she had a whole cohort of women she had been following for over 10 years. Some of them even 15 years and more. So she invited them back to come back to the university, and a lot of them did actually, to have a biopsy of their cervix for the purpose of looking for human papillomavirus DNA in the cervix. Now, most of them now had a normal cervix. They had already recovered from whatever went on in college. And the purpose of it was to see if the virus is still hanging out. And in a large percentage of the cases, it was. And so why would that be? And some of the women, they still were having ongoing problems with their cervix. But they still found HPV even when there wasn't a problem. And yet we say that HPV is causing the cancer. So is it causing it, or is it there for another reason to assist? It's not clear. Is it a biomarker for the cancer? Maybe, yes. But is it causing it? We're not sure. And with HIV, you may have heard about Magic Johnson, who's pretty public about his HIV. And after many, many years of taking medications and suppressing the virus in his blood, everybody bantered about whether he was cured and could HIV be cured. But when you go looking for HIV in other compartments in the body, you find it. And especially if you stop the medications and you stop the pressure on the virus, it resurges in the blood. And so there are many other examples that I could share about viruses seeming to stay in the body long after the infection or the problem resolves. Chickenpox is another one. Yes, exactly. And shingles is a reactivation of it, kind of spontaneously, and not much is known about why that happens and when, and so on. And if we look at something called exosomes, this is an area that's very exciting for me personally about where this could take us in medicine. Exosomes is an exciting area of research in the last decade especially, and it's exploding, the science there. And luckily, there is an interest from the pharmaceutical industry because of the possibility for developing pharmaceutical drugs that could target exosomes to help the body. And so that allows us to learn about what the exosomes are doing by some of those studies. And this picture here shows you a schematic of what they look like. They look a lot like viruses. They've got these kind of funny proteins on the outside that they use to attach to cells for entry. They've got genetic material on the inside that's used to translate messages to the body. And it's RNA material, like the RNA viruses. And the cells create the exosomes. Originally, these exosomes were called waste byproducts of the cell because it was felt that it was just some waste that it was excreting that had no purpose, which the body has a purpose for everything it does. It's an innate healing mechanism. And the exosomes, when they're released from let's say an organ, then travel to other areas of the body to send a message there. So in a mouse model, as an example, researchers are doing things to manipulate the exosomes in the laboratory. And in this case, it would be the case of a heart, let's say, that has an injury from a heart attack. And you can manipulate the exosomes to translate messages to the heart to regenerate itself. And then they put the exosomes back into the mouse and they track it, and lo and behold, the heart starts regenerating itself. And so this is how exosomes will be used in the future. But there are other ways in which exosomes can assist us, because you can find exosomes in all the bodily fluids. The saliva, the blood, breast milk, they seem to be everywhere. And you can tell what's going on in the host, the body, by seeing what the exosomes are expressing. So this might in the future be a way of looking for biomarkers for illness or cancers in a very simple way. Just by taking a sample of saliva, we might be able to tell, oh, wow, it looks like you're expressing information that would suggest there's a cancer, a breast cancer, a prostate cancer, what have you. And what this is most exciting to me is that exosomes are traveling around the body. Our body is making them ourselves. And these exosomes are traveling to areas of the body to communicate messages. And this is something that thought leaders like Bruce Lipton have been talking about for years and writing books about, which is that our body is an amazing communication network, and that somehow messages are being conveyed around the body. Now we think of the microbes as the bacteria being wonderful communicators, signaling. The gut flora is signaling to the flora in your nose, signaling to the flora in your anus, saying, hey, we need this, we need this, we need that, let's do this, and partnering. And in the same way, viruses are assisting, and exosomes are assisting with their genetic material. In Japan, the scientists there are calling the exosomes mysterious messengers. And Rudolf Steiner, when he described the virus from the Spanish flu, he described viruses then as poisonous excretions from the cell. Poisonous secretions from the cell. Kind of like was described originally for exosomes, that they are wasteful byproducts or with no purpose. But that doesn't appear to be true. And I think what's super exciting is that if we start thinking about the whole picture, the electromagnetic grids, the water in the body, the cells, the microbes, the energy meridians, the chi and how it's flowing, and then we add to that emotions and thoughts, we can start telling a story about how these frequencies and the environment that we are in is all affecting that environment within the body on how it wants to express itself. And so what they're finding with the exosomes, as an example, is that the exosomes may be recruited to go to the cancer to help grow the cancer, depending upon the belief system you have. So if your belief is you're going to get cancer and you're going to die of this cancer, then your body is going to create exosomes to help fulfill that for you. If you believe that you're not going to have any of that and it's not going to be a problem, your body is going to make exosomes to go identify that foreign body over there, that cancer, and tackle it. Now, there you go. I use the word tackle. Shame on me. Because I really think we should be thinking about this idea of what's called mutualistic symbiosis, where we are working toward unity consciousness. So what is unity consciousness? And the universal law of one is that we're all one and that we're all working together in cooperation. And so the idea about attacking the cancer, killing the virus, all this kind of talk is more polarity and duality rather than the unity consciousness kind of thought process. And so our own awareness is the first step so that we can catch ourselves as we're speaking and we're thinking and ask ourselves, why did I just say that? Where did that come from? And do I really believe that? And let me transmute that. And those sorts of things.
Exosomes will be used in the future to identify or screen for cancers or other chronic conditions, and also will be used to establish the status of our virome. Many viruses now are being identified within exosomes. Some researchers are in fact wondering if COVID-2, the virus that is believed or is associated with COVID-19, researchers are wondering if this COVID-2 is a form of an exosome in essence, because it's indistinguishable under electron microscopy. I believe respiratory viruses are being detected through PCR in the lungs, not necessarily because the virus is there causing the pulmonary illness, but because somehow that virus is assisting the body in clearing a toxicity from some kind of insult or injury that's occurring perhaps related to 5G and or other shock traumas to the body. And in this way, the virus is bringing resources to the area, creating signaling throughout the elaborate cellular network in our body, trying to aid in clearing the toxicity so that the body can thrive.
And so when we think about this pandemic and this coronavirus rapidly affecting the globe all at one time, it doesn't all make sense if it's simply COVID-2, the coronavirus that's linked to it, as causing the whole thing. Especially if the incubation period of COVID-2 is 14 days, which is what we're told. And we're still practicing. So what does that mean? That means if you're exposed today, you may not become ill for 14 days. That's a long incubation period. There are other viruses like chickenpox which have an incubation period like that, but most respiratory illnesses are not like that. The flu, usually 48 hours. You're going to get sick pretty quick after exposure if you're going to get sick at all. So how did the whole world become sick all at once if it has such a long incubation period? And that's, very troubling to me to work out. It doesn't make sense. And so also social distancing, even after travel was restricted and we were all mostly practicing social distancing, we still saw a lot of things going on. And so why didn't it fix it? And why didn't we see a bigger problem in the jail where we can't practice those things? And so it doesn't all add up. Now, why would the government be pushing the social distancing and the masks if they know it's not really working? It could be because they didn't know about the case fatality, which I mentioned, which we know now though. It could be because it has to do with some kind of control, or another thought is maybe they don't want us to develop herd immunity. And what's herd immunity? You mentioned it perfectly, chickenpox. So, back in the day before vaccination for chickenpox, if one kid got the chickenpox, you wanted them all together so they all get it. And the reason is because it's self-limited infection, and you don't want to succumb to that when you're older, because that can be a severe illness. And why? Because it's all about the host. So if you're older and there's other things going on, you may not have such a self-limited illness with chickenpox. And because we knew that, that's why we do those things. And if you remember the Brady Bunch episode, there was one where somebody got the measles and they went on vacation so they could all get it and be together. And so this kind of herd immunity, if you will, creates this closeness, creates bonding, creates social interaction, and creates a robust virome in the body, and creates immunity and boosts it. And even back in the days of smallpox, Dr. Edward Jenner in the late 1700s, who's some call the father of vaccination, he observed that the women who were milking the cows weren't getting sick. And it's because they were getting exposed to cowpox through the cows, and they had partial immunity. And we can see this with other viruses like herpes virus. If you already have herpes type 1 and you come down with herpes type 2, you tend to have a milder course. So there's this idea of partial immunity too. So how do we know that, having had multiple colds in our lives and respiratory illnesses and colds, that we don't already have partial immunity to this newer coronavirus? It's presumed that we don't, but we don't know with certainty. And how about these nursing homes where they're all coming up positive? For me, I wonder if some of that has to do with them being a heavily vaccinated population. So most certainly, if you're living in a nursing home, it's going to be mandatory you get the flu shot, unless there's a strong contraindication. So that's going to be a higher percentage of people vaccinated than your average community, because a lot of people don't take the flu shot. Roughly half just don't. So when we're coming up with a lot of positive PCR tests for coronavirus in nursing homes, could it be that we're simply finding the virus in their nasal secretions? Some of them aren't becoming sick. They're just testing positive. And we don't have a big experience running around nasal swabbing everybody for coronavirus. We didn't do that routinely before. And if we had, we might have found that 30% of the population had it. We just don't know, because we haven't done that before. So be mindful when you're hearing about positive tests, and take it into account, well, what's going on with the person or the people affected? Are they ill? All disease arises from unexpected shock. This is what Dr. Reich Hammer said, and he's a German scientist physician who dedicated his entire career basically showing this and practicing this clinically. And I showed this picture to give you an idea of what I'm sensing in the body when I'm working on the body with my hands, sensing what's going on in the energy field. You can sort of sense in this picture that there's something going on with the concentrated light in the middle. And this is how I visualize it while I'm working, and what I might feel. And depending on what it is, it might feel hot, it might feel cold, it might feel tingly, it might have no tingle, it might be really depleted. And this is what Dr. Hammer would say represents a shock trauma. And shock traumas have real measurable frequency to them. Lots of people are using sound, light, Reiki, other modalities to remove or balance these kind of shock traumas in the body. And I can tell you from my own experience that after Teresa died, and that was a shock to a lot of us, a lot of things happened. Right after that, not too long after, I was diagnosed with thyroid cancer out of nowhere. And her daughter was diagnosed with type 1 juvenile onset diabetes out of nowhere. And what I find, and others are describing as well, is that shock traumas seem to hang out in our glandular organs and in the brain, and the teeth hold a lot of these emotions too. Interestingly, teeth are tied to a lot of it. And doctors don't talk to you a lot about your teeth, and they should, in a different way than the dentist. And they should be working more with the dentist as a team, and because it's all related. And so I find the pancreas and the spleen in particular really hold on to shock traumas, and pancreas is what would be affected by the diabetes. And when you remove these, or balance, or depending on the modality you use, when you balance these emotions or traumas out of the body, there still remains a distorted grid left that needs realignment or balancing in many instances, because that density or distortion has been there for a while, and the body has been working to contain it. And so there's been some distorted messages around that need to be balanced. Another thing I noticed after Teresa died is that I was still having to release a lot of the grief, naturally. And what happened is it manifested for me in my lung large intestine circuit, which makes perfect sense because the lung large intestine circuit, which also includes skin, is where we hold grief and loss. And if we don't release it, it will be held there until it's released. And so emotions and teeth in particular are big circuit breakers, meaning they cause voltage in the energy meridian to become depleted rapidly. And if you don't have enough voltage or life force in your meridian, then you're going to start developing imbalances and problems in the tissue anywhere along that field. And so I started manifesting an issue with the nervous system in my bicep muscle and in my neck, all involving that meridian. And it was on my left side, my yin, which, where I really needed to release that grief and loss from her. And so these emotions come up as a way of letting us know there's a problem. And what do we tend to do? We want to just get rid of that, or take a medicine, or take something to numb us and not deal with it, and because it's painful. But it's there to let us know that there's a problem. So what happens when the red light comes on in your car, that the engine's got a problem? Do you just cut the wire and keep driving? That's what a lot of us do. And eventually that's not going to work. And so I see the body as a series of energy meridians, which is traditional Chinese medicine. And this makes so much sense to me. And practitioners of 5-element theory also talk about the meridians with regard to the elements and how they tie to the organ systems. And so the elements represent the different meridians, and then the meridians are tied to specific organs. And practitioners of 5-element theory pay attention to order of things and seasons for things. And so as an example, the lung large intestine circuit, which also encompasses skin, is metal. And it's also, the season is fall. And so if we look also at kidney bladder meridian is water. And the emotion for kidney bladder, typically that is fear when it's imbalanced. The emotion for lung large intestine, grief or loss. And water and kidney bladder is coming up in winter. So this might mean that during winter, that's when we really should be doing things to strengthen that circuit and being more mindful of our kidney bladder circuit. Same thing in the fall with the metal. And isn't it interesting that flu season occurs in the fall and winter, affecting the lungs and a lot of fear going on? And this is when you see these pandemics. Also, when people are inside, vitamin D levels are lower, it's colder outside, you're not out in the sun as much. All of these factors play a role. Air pollution's probably higher in the winter. And in Chinese medicine, they would say that most of us have a primary constitution, or at least a couple of elements are our primary constitution. So when we come into this life, we likely come in with a dominance in one or two of these elements. And so for me personally, I feel that I'm strong earth. Earth is often healers because earth is stomach, spleen, meridian, also encompasses thyroid, a lot of your hormones, your glandular, your digestion. Earth is your solar plexus. And your solar plexus is connecting your crown and your root. Connecting your fire is root, and also wood, liver, gallbladder. And your crown and higher is more to do with, your connection with above. And so the solar plexus is very important. That's where you get your sense of power, your sense of self-esteem. And so when earth is imbalanced, either you're nurturing everybody else and you forgot about yourself, or you're sucking everybody else's energy dry because you're so needy. Either one is imbalanced earth. But when earth is balanced, it's the most beautiful expression of nurturing and probably unconditional love that exists. And how is that helpful? Well, it's helpful in that if you know that about yourself, and that might be one of your soul's lessons while you're here, then when those things start coming up again, it's a reminder, I probably need to be practicing self-love again. And I think a lot of us are here now in trying to work through the self-love piece. The planets listed at the bottom correlate with the elements, and it's said that these 5 major planets, Jupiter, Saturn, Mercury, Mars, and Venus, were the 5 major planets that contributed to the dimensions coming in when Earth was first seeded. And these elements tied to that. So Jupiter is tied to wood, and that's shown in the green. Saturn is tied to earth, Mercury to water, Mars to fire, and Venus to metal. And when I'm working in the body, thinking about these meridians, the elements, the organs, the cells, and how they're communicating, my hands, in essence, become supercharged. And that's what this picture is intended to show you in a visual way. This is what I feel. And I feel sometimes that I can manage the energy, kind of like the globe of light you see there. And I can play with it. And I can feel when sometimes density wants to come out of the tissue and sometimes light wants to go into the tissue for realignment and restoring the grid. And I have a patient named Rita who I've become very close with, and she's been a teacher for me in many ways, which is what ultimately happens when you're working as a doctor or healer in some capacity. And she has breast cancer. And when I'm working on her body, I can feel, or I'm starting to get a feel for what the cancer feels like. It feels colder and it feels denser. Whereas if she has inflammation in the spine, let's say, with pain, there's more heat there and it feels different. And the emotions in her spleen feel tingly and lighter and not quite the same as the density of the cancer.
And I work on Rita once a week energetically, balancing these areas where there is too much density or heaviness and restoring the electromagnetic grid that feels more in line with her original template. And as a result of all the things she's doing, which is important to note that it's many things that go into healing, just as it's many things that help the person acquire the disease in the first place. But as a result of her efforts and her healing journey, her scans continue to show improvement with resolution of many of the areas where she had significant tumor burden. And her labs and tumor markers are reflecting similar results. Exosomes and viruses are behaving in the body in a way in which they can communicate within our elaborate cellular network and provide a basis for how our emotions and thoughts affect the structure of water in our cells and affect the expression of the RNA messages created by the host. The components of the genetic material inside these exosomes and viruses contain remnants of many viruses, and these are viruses that we've either been exposed to or acquired prenatally from our mothers or over our lifetimes. And I believe that many of these pieces or remnants of virus are ultimately tied to our planetary lineages. If there's a mutualistic symbiosis or a partnership created between the microbes and our body systems, this benefits both. And ultimately, evolution can prevail, the body can thrive, and thus so can humanity. We are evolving as is Mother Earth, and perhaps after today, you'll consider how and why viruses are assisting us in this process.
And so, what I hope to have done today is to give you an idea that viruses and exosomes, and they may be the one and the same, but that's not been clearly worked out. They're now finding evidence of viruses in exosomes. So they found evidence of HIV, coronavirus, hepatitis virus, and others, poliovirus, in exosomes. And whether they're the same or not precisely, I don't think matters that much. The point being that these virus-like particles that are in our body contain these important genetic material within them that are carrying messages throughout the body about what kind of healing may need to happen. And they're working in conjunction with our meridians, which are used to communicate information between the organs as well. And the more that we can think about how all these things are working in a mutually beneficial way in the body, the more likely we are to heal ourselves from within. And this is, again, about unity consciousness. Because after all, if a conventional doctor like myself on a very conventional track can awaken, so can all of you. And one thing that I noticed that I thought was interesting was my former spouse kept saying to me, you know, the things that you used to say 5 years ago and do 5 years ago, you don't do now. And the things you're doing now, you would have never done or said 5 years ago. And I would agree with him. You're right. It's absolutely correct. And there's nothing I can do about that because that's why we're here. And I think he wanted me to go back and be the person I was. And I understand that and I have compassion for that. But that's not why we're here. We're here to grow and expand and to help each other grow and expand. And in that way, we can help each other ascend into this age of Aquarius, which is what our heart's desire is. I believe that's why we're all here. So I'll take any questions with that.
One of my questions was with the COVID virus or the coronavirus, it came from an animal originally, correct?
Well, that's an excellent question. So where did the coronavirus come from? It's not entirely known. So a lot of people are talking about, it's came from the lab and then came out of the lab through error or purposeful, who knows, and then contaminated some chickens or animals. But what host? Or was it the bat? And there's another animal, can't remember the name right now. No. Pantolins. They're kind of unusual creatures, and they're night creatures like bats. And so the coronavirus CoV-2 has been identified in them. And so has it gone through those two different hosts and then gone to humans? And in what way? Is it because a human was exposed to those animals and got contaminated? Or is it because somehow it was introduced another way? It's not known.
Wouldn't naturally have that in our system.
Right, so that's a good point. Is that why sometimes we become sick, like in Spanish flu, with avian flu, when it mutates and it's something that hasn't been in the human before and is introduced for the first time? If we are truly naive and have no partial immunity, that's perhaps when we would become the sickest. And that's...
I just thought you had said that we have COVID virus in us at all times.
Well, we have other variants of coronavirus.
Okay.
Coronavirus is the common cold.
Okay.
And so CoV-2, it's called, for the virus causing COVID-19, the syndrome recently described, is a mutated new variant of a coronavirus that's not been seen before. But we have seen certainly other coronaviruses. Even when you go to the hospital with pneumonia, it's not uncommon for them to do a nasal swab and run it for a panel of respiratory viruses, and coronavirus is in that panel. It's a different coronavirus.
So this is fascinating to me. I take a treatment monthly or every 6 weeks, actually, and so they test to see if I have the JC virus, because if I have the JC virus, I can't take my drug. So I think of like Reye's syndrome with the chicken pox, and so I'm just curious, like if I wanted to keep up with this line of research, like where would I go to, just keep going up and up like you are?
I think the most important thing to keep in mind is if you're balanced, your body is balanced. If your meridians are strong, your chi is strong, your immune system's strong, your vitamin D levels are high. Most people have a vitamin D level of 20 or 30, and the lower limit of the range is 30 about, but it goes up to 99, and the sweet spot's probably around 60 or a little higher. And those kinds of things, feeding your immune system, being mindful about your diet. There might be things that are triggering your immune system. And sometimes there are things that are on the healthy list, but your body is sensitive to it right now, and those are important things to sort out. If you're emotional balance too, we all need to keep doing our work because we're still living here and there's still stuff happening. And so it's that's a lifelong process. All of these things are going to help keep that JC virus contained. Now, is the JC virus causing, or is it more a biomarker for trouble in you? I would say the latter. And so it's still a valid, helpful test for you, but it probably confirms what you already know by the time you're having it because you're exhibiting clinical signs and symptoms. So I find the best approach, no matter what we're talking about, whether it's flu, coronavirus, Lyme, mold, anything like that, autoimmune, mystery illness, it's all, in general, the same answer at the end of the day, which is looking at a very holistic, well-rounded balance. And there's so many different ways you could do it and look at it. And there's many practitioners who could do many types of work in these areas. But that's where my focus would be, on keeping your immune system strong and trying to understand what the root cause is. In my experience, there's a few categories of root cause, and most practitioners may be good at treating things, but they don't ask where it's coming from. And if you don't fix the root cause, even though, let's say, ozone is great and helps you, you're going to need it a lot the rest of your life. Right. Which I love ozone, but I'd rather not do it if I don't have to. So what's the root cause that's draining the circuit? Is it a tooth? Could be a tooth. Is it an emotion? So what are the teeth issues? Is it a root canal? Root canals are big circuit breakers. Why? Because there's still bacteria down at the base there, and bacteria can really deplete the circuit. Or is there a big emotional? A lot of times when I look in someone's history, there's a big emotional trauma a lot of times in their childhood. Or it's not even yours, it's your mom's or your dad's or everybody's, your whole ancestral lineage. And you're here to transmute that. That's what you signed up for, possibly. And so first is the awareness, and then how do I do that? And teeth, as I said, are very fascinating because there's a naturopath that I worked with in a training experience that I did with sound balancing with tuning forks. And what she taught me was, she had a whole case series she's writing up. She had over 50 cases at the time. And what she found was that wisdom teeth, when they're coming in sideways, is an emotional thing. And you can balance it with sound very effectively. She uses the tuning forks very effectively. And guess what? The wisdom teeth shift and they come in properly. You don't have to pull them. And when you pull wisdom teeth, it's a big circuit breaker. And a lot of times, it's classic conventional medicine. It's coming in sideways, well, let's just pull it out. And we don't worry about the long-term impact. And a lot of times we use epinephrine because we don't want a lot of bleeding. I got another case in 15 minutes. And the bleeding helps cleanse it. And you're still leaving perhaps part of the pulp of the tooth or a dead ligament in there. And it's the only place in medicine where you leave something gangrenous in the body and you think it's okay. And so sometimes you have to go in and clean that stuff out. But the wisdom tooth is tied to your heart small intestine circuit. And all of us are trying to expand our heart fields right now and feel more joy. And we might be doing a great job in our daily work, but the wisdom tooth we had pulled when we were 16 keeps shorting the circuit out. So you can correct that, and you can correct everything else, because the rest is all compensatory, trying to adapt to that. So a lot of times it's just trying to go back and find the root cause, and you can kind of map your life story on a timeline. And a lot of times it's big emotional things that happen. Teeth, those are big ones.
What if you only got 2 of your wisdom teeth?
So there's ways of sorting it out and seeing whether those 2 are a problem. And you can do kinesiology, simple muscle testing. Yeah. And So there's people who've spent their entire life, the naturopath I worked with knew a dentist who dedicated her entire career to writing a manual about teeth. And when only 2 wisdom come in and not the other 2, what does that mean? And when the molar does this, what does that mean? And there's all these meanings that she observed and wrote a manual about in Italian. And this naturopath happened to be first language Italian, and she's translating the entire manual into English. And she's practicing with another doctor in Texas, applying those principles now. And in fact, she did a sound balancing on my daughter, whose wisdom were coming in sideways, and the wisdom shifted.
Sinus infection every month. And finally they said, well, you need sinus surgery and all that kind of stuff. But my teeth hurt all the time, and I know they say that's part of the sinus infection.
Well, there you go. So the sinuses are tied to the heart small intestine circuit, which are tied to the wisdom tooth. And in your own words, you already know what's the problem because you can feel it. Well, you said you can feel pain in your teeth, and you have this sense that it's tied to your sinuses, and you're probably right. So you need a biological dentist who's mindful about these things.
A what?
A biological dentist.
And where do I find?
I'll help you after.
Oh, that would be really great. Thank you.
You're welcome.
Something's wrong. Yeah.
Just a quick, when you talked about the viruses either having the RNA or the DNA
Yes.
structure within the coronavirus, is that DNA or RNA?
The coronavirus is an RNA virus.
RNA. Oh, good. So it's
Yes.
it's why it keeps adapting.
Keeps
and
mutating and evolving.
Oh, good. So they can't really
Yes.
catch up with vaccines then. That's good.
That's correct. So it makes vaccination, in my opinion, really not appropriate or a great strategy for these RNA viruses.
So if I wanted to pursue any of these things further with what you're saying alternatively, how can I find you or work with you?
Yes, you could contact me through Facebook, or my office number is 813-515-7357.
Okay.
In Tampa.
Okay.
I do. I work remotely.
Dr. Beth Mitchell, or would it be?
Under Dr. Beth Mitchell. Correct.
What's the name of your wellness center?
Restorative Healing and Wellness Center.
Please recommend how I can find capable healers who are appropriately trained to administer ozone, and 2, how do we encourage the current medical system to accept ozone?
That's an excellent question. So first off, there is a website, doctorsozone.com, DRSozone.com. It's not an end-all be-all website, but it does list certified ozone treaters. And then you could see if there's one in your area. That's one way. It is my mission, in part, to help awaken physicians. And whether or not ozone will ever be conventional mainstream in the near future, I think is unlikely, because there's nothing in it for the pharmaceutical industry. So as long as the pharmaceutical industry is dictating standard of care for physicians, it's not going to be mainstream. However, in Europe and other places where the pharmaceutical industry does not have as much authority in that way, ozone is quite normal and common. In the United States, not as much. But there are all kinds of ways you can receive ozone, and you can do it at home with some simple measures, and then there's fancy equipment that you could also do, like in a sauna or IV ozone at a doctor's office that has training in that area.
So if strike and heart attacks run in a family, is this a reason to be given a statin?
So the standard of care in the United States is would say yes. That if you personally have had coronary artery disease, then you would take a statin. That is not my answer. The reason being that cholesterol, when it's elevated, is a marker of inflammation in the body. It's not the cause of the heart disease. It's a biomarker. And so you can take a statin and lower your cholesterol. Does it lower it? Sure does. But it causes a lot of other issues in the body that you also have to deal with. It causes, a lot of people have myalgias and muscle aches and pains and other side effects from statins. And then you still haven't identified the root cause of the inflammation. So I'd say if you have a long history of heart disease in your family and stroke, and you yourself have high cholesterol, it's important to find out what's going on and why you have so much inflammation in the body and what you can do about it. In the case of my father, who had the elevated cholesterol, we do alternative treatments with him, holistic. He does ozone treatments at my office and regularly, and he takes vitamin D and does other things. So those are, and his cholesterol actually has gone down. So now when he goes back to the primary care, they're not bothering him about the statin anymore because the cholesterol has already lowered. And so that's what the doctor is concerned about, is getting it lowered to reduce your risk. You can do that in all kinds of other ways.
Is there a reset of some type that we can mitigate some of the damage to our systems?
There's lots of ways to reset. I don't think there's any one answer. That's what I'm doing when I'm working in the body, is essentially trying to see where the root cause may be, and also trying to remove things that are not serving the body, things that are too dense, or removing toxins or emotions, and then restoring the grid. But there's a number of practitioners out there doing other things in other ways. I don't have a magic answer on that. You know, even Ethan's energy transfers are a great way to start removing a lot of that kind of thing as well in another way.
About viral events and joint replacement, piggybacking on the brushing of your teeth comment, is it possible or likely that dental procedures may cause deep infection in a hip or knee joint replacement, possibly requiring limb amputation? If so, would the possibility be the same with a manufactured joint as it might with a cadaver source joint? Additionally, with a cadaver joint, is there a risk of rejection as there is with an organ such as a heart or kidney?
Yes, and yes. So any foreign body, there's a risk for infection. And the companies may and the doctors may have statistics about one being less than another, but all foreign bodies have the capability of having an infection, as even if you're careful and healthy and all the rest. And might that lead to amputation? Well, that's kind of extreme. What it would lead to is probably something more painful than that, because you wouldn't just have an amputation. What would happen is you'd have to have the joint replaced. You'd have to have long-term treatment to treat the infection, and then you're at risk for having another infected joint and that kind of thing. And cadavers, you run the risk of acquiring microbes and other frequencies and energies related to that cadaver tissue. So that's just, and run the risk of rejecting it. Yes, that's always true with anything like a graft or something coming from a cadaver. You can restore joints with ozone. Ozone helps cartilage regrow, helps inflammation. There's lots of other ways too, that platelet-rich plasma. You draw your own blood, they draw your own blood, they spin it, they pull off the growth factors off the top and inject it back into the joint with or without ozone. Stem cells and exosomes are being used to help joints heal. So there's lots of other things you could try before replacing the joint.
How do you detox from heavy metal toxicity?
There are a lot of ways to detox from heavy metals. Some of the older techniques, chelation and things like that, are invasive because you're doing an IV and it's pulling out other minerals and things from the body that have to be repleted. There's another modality called laser detox, and this is where you can make a little homeopathic remedy containing the heavy metals that are most prevalent in your body. You shine a light through the homeopathic remedy and you can pull it out of the body through the skin by doing this kind of a procedure. This is not widely talked about mainstream, but it does work and it is pretty effective and non-invasive. There are other ways, far infrared heat. So a lot of people are going to these sweat lounges and going in the infrared saunas. Ozone saunas, a lot of them have the infrared technology in them. And far infrared is a great way of pulling toxins out of the body naturally. If your body is balanced and your liver is not stagnant and is properly working with your kidney bladder circuit, you can naturally detoxify. We were made to detoxify ourselves naturally. The problem is we're overloaded. Too many toxins, we're depleted, we've got a lot of anger and frustration and old emotions hung up in the liver. Our mineral count is low because we don't ingest the minerals, the soil's ruined, so we're not getting the minerals there. This is compounding the problem. And all of these things make our detoxification circuits impaired. But if you can find ways of restoring those detox circuits, you can detoxify naturally yourselves.
What's the best way to treat chronic yeast infections without antibiotics? Are yeast infections due to intestinal parasites, and are these parasites due to high carb diet?
Well, all of that to me sounds like an impaired microbiome, and that could be related also to diet. And as you mentioned, ozone is a great way of balancing the microbiome and in the vaginal area, the whole pelvic area. You can buy a catheter and you can do your own ozone at home using a little generator with oxygen, and you can ozonate your vagina. Change your vaginal flora and change the whole game. If you don't want to do that, you could seek a practitioner who has ozone. There are lots of ways, though, of restoring a balanced vaginal flora, but most likely the flora there is abnormal or imbalanced because the gut is also imbalanced. And sometimes balancing the whole body does the same.
Curious if I have a belief system that clearing toxins and poisons from chemo and transmuting into golden liquid light, would the exosomes take on the belief to create it?
Yes, absolutely. You can change your cells and reprogram them to do anything you want. But if you don't believe it, it doesn't work. So you can try it out for yourself. You can rehearse some of the I am statements that you're creating. And if they don't resonate, if you're depending on how in tune you are and whether or not, if you know kinesiology, you can muscle test it. You can make a ring with your finger. It's a simple way. This one's probably the strongest, your ring finger and your thumb. And you want to test the strength. I am Alaia. I am Alaia. Can't break it. Strong. But if I said I am Barb, I'm Barb. Now I'm Barb. I can't do it because I'm not Barb. Now that looks like I'm making that up, but you could try it and play with it for yourself. There's other ways of doing it. You can look up kinesiology, but we have the ability, our body knows the answer, our subconscious, and you can test things for yourself. So you can practice your I am statements and find out if they're holding true. And if they're not, you need to do some more work. Once you get strong in those I am statements, you can reprogram your body to do whatever you want.
There are so few Eastern Western intuitive wellness practitioners, it's difficult to access this valuable care. Are we seeing an increase? Is there one source list we can access to start finding and engaging with them now?
And what was the beginning?
There are so few Eastern Western intuitive wellness practitioners.
Oh.
It is difficult to access this valuable care. Are we seeing an increase? And is there one source list we can access to start finding and engaging with them now?
There's not a one source list at all, and it is very convoluted, something that is one of my own pet peeves. So, because a lot of people I find are having to go to 5 different practitioners to find what they need, because that one only does that, and that one only does that, and so on. It is really challenging, but that's part of the transition we're in right now. Physicians, anyway, I can speak for myself, are awakening more and more these days. And as that occurs, then this will improve, but it's going to take some time. But I don't have an easy answer for that. You can't just go to a website. I will say this. I think it's incredibly important that whoever, I don't care if it's an MD, a DO, a nurse practitioner, a PA, a naturopath, none of that matters to me. I don't care if it's none of those things, if it's the right person. And so, first off, you have to believe your healer or practitioner has the answers. So if you're just going to your practitioner for a script because you have a sinus infection and you want an antibiotic and you don't care about anything else, then that is what it is. So that's not the kind of practitioner I want to be. And there's plenty that are going to serve you for that. However, if you want real answers to try to see what's going on with your health, then you have to go to somebody who you believe in. If you don't believe your practitioner has the answers, then they're not going to help you. You have to believe in your practitioner as much as you believe in yourself. And then your practitioner, the job of your healer, in my opinion, is to pull the answer out of you, because ultimately you know how to heal yourself. You have all the answers. How do I get it out of you? That means I have to work with you in a partnership. And you're right. Many healers don't do that. And so I always say, I'm never going to do something to a patient that I wouldn't do to myself, or I'm a hypocrite. And when you go to your practitioner and they tell you, you need to do this or that, or this is going to happen, or whatever they say, you might try asking them very professionally and politely and respectfully back, would you take this medicine if this is what you had? And they may be off-put by they may not expect that question, but read them and see what their answer would be. Because if they're that's probably not who you want to go to. Because a lot of doctors don't practice what they preach because they know better. And but they're still in fear. In all fairness, I have compassion because I am one. They're in fear for not following the standard of care. And they have reason to be fearful in the sense that there are sometimes consequences for some of these things. And that's why it's hard for them.
We still have a lot of questions, but we're out of time. So maybe you want to just share your contact info one more time and we'll wrap it up.
So my phone number at my office is 813-515-7357. The name of my center is Restorative Healing and Wellness Center. You can find me on Facebook, Alaia Greene. alaiagreene@gmail.com. Or find me through Flower of Life.